Thank you and welcome to the update for COVID-19. I'm very pleased to be joined by a global team of experts today and introducing them, Anneline Booyse-Mofokeng from South Africa, Dr. Katherine O'Reilly from London, and Dr. Olivier Lo from Singapore. Today, what we'd like to do is take you through some of that regional perspective around what we're experiencing, both from a community point of view with COVID-19 and how we're reacting to a return to operations or return to office environment. And then also some specific client experiences around that kind of space. Before we go into that, perhaps the best way to start the update is to pass it across to Dr. Olivier Lo for the COVID-19 situational update for the last week. Olivier, can I pass to you?
As of the 15th of June today, the news are not so good in terms of COVID-19. I may remind you that worldwide we have over 7.5 million cases. 48% are identified in Americas, with a lot of increases of number of cases in Brazil and 30% of them still in Europe. The total death fatality worldwide is still high as well, is getting closer and closer to 500,000. It's exactly at 427,000 plus, and still almost all the world affected. 188 countries, that represent 98% of the countries in the world reporting COVID cases. May I remind you that under the UN, we have 193 countries registered. And the not so good bad news as well, it's accelerating in Africa as well, with over 200,000 cases so far in the whole of Africa, and South Africa is accounting for a quarter of all the cases. So those are the numbers that are not so good. And what has been happening the last week or so, as early as yesterday on Sunday, you probably have heard about the Beijing lockdown of 10 residential compounds, probably because of a new outbreak in China, in Beijing. They were fortunate enough to have 2 months with almost no new coronavirus infections, and Beijing has recorded a dozen new cases in recent days. It all came apparently after contact tracing from a wholesale food market, Xinfandi, that is now being closed. And according to Reuters, as late as yesterday morning, Sunday, there were up to 51 cases, including 8 reported cases in the first 7 hours of yesterday, Sunday. So not so very good news at the moment, but we see the authorities reacting very, very quickly and very diligently. So we are talking about partial lockdown of Beijing now, and that will affect some of the flights as well, I think, the incoming flight to the capital. Other news, WHO finally recognized the efficacy of the mask. They've issued a new guidance saying that in light of evidence, they advise the governments to encourage the general public to wear masks now, where there is a widespread transmission of physical distancing is difficult, public transport, shops, or any confined and crowded environments. This is the first time the WHO has recommended masks so broadly, and they say that it's now established that people who are asymptomatic, not pre-symptomatic, but asymptomatic, may spread the COVID-19 virus. And so there is a strong recommendation now for wearing masks. Mind you that there is also novelty. The WHO is mentioning that the mask with fabrics would be efficient as well, at least if the mask are having 3 layers of different materials. Something new, very interesting and more encouraging this week. It's the de-escalation of the COVID travel restriction in some countries. We talk about bubbles or safety health corridors. The latest one was between Singapore and China early last week, but we see this happening between Australia and New Zealand, The next one coming up is probably between Singapore, South Korea, and Japan. We've seen already this movement as well, opening the sky for the travelers between Estonia, Lithuania, and Latvia in Europe. Denmark and Norway, mind you, without Sweden, is opening the sky as well. And we have seen this between Germany, Czech Republic, and Austria. And finally, last but not least, the International Civil Aviation Organization has issued a new guidance called the CART takeoff. It's CART stands for Council Aviation Recovery Task Force, CART. And if you're interested, you may visit their website, and they're giving, and you see in Singapore as well, you can hear the Singapore Air Force Aviation is having exercise as well here. And you can see as well from the CART takeoff publication, new guidance for airports, aircrafts, crew, cargo, how to protect against COVID. And it's a very positive move to help the various industries to adjust and to give some direction what to do when travel is resuming between various countries. Mike, over to you.
Lovely, Dr. Olivier, thanks very much indeed. Clearly, over the last 5 months, while organizations have been managing response to COVID-19, there has been an ebb and flow. And as you raise, this issue with China seeing another influence, it's likely to change some of the responses companies will have to deploy. We've clearly seen new challenges developing across the health and safety environment, and in regards to companies protecting their workforce. Let me pop across to Anneline first, if we can. Anneline, can you give us some indication across your experience with your clients in Africa? What are the insights you're seeing? What are the challenges you're seeing with organizations? And what are they struggling with?
Thank you, Michael. Thank you for that question. As Dr. Olivier has mentioned, Africa is quite unique in its experience with the COVID-19 crisis, not just on a medical side, but certainly also on a security side. And what we really see is companies being worried about mostly returning back to work. And as everybody's talking about the new normal, companies understand that we cannot do things the way we used to do before COVID has taken over. And what we certainly advise our clients in Africa is considering the risk rating of the country, very important to do a refresher security awareness training for those who have to go back to work. As we know, most of us have worked from home for the past 2 months and more, pending on the lockdown regulations that has been implemented. We now have to readjust going back to work, and having a security awareness briefing or a refresher training is certainly something that we highly recommend for companies taking their workforce back to work. Also, with regards to COVID-19 measures at work, we do see that different countries have, or different governments have different recommendations or requirements with regards to the regulations and measures that needs to be implemented at work, at the workplace, and most of these have become law or are effective as part of the state of emergency situation that these countries are experiencing. And it's very important that the companies have to ensure that these measures that they're implementing, there's very clear indicators on how it impacts on the security arrangements at work or security protocols at work. And while they will sit, or crisis management teams will sit around tables and implement these measures, it's very important to include the security team in these discussions, but also to share this new measures and new regulations with the workforce. What we also see is potential protests that companies need to prepare for. Most of the countries, as they reintroduce the workforce back at the workplace, we see regulations with regards to numbers that are allowed to go back to work, limitations in terms of workspace and so forth. As a result, you cannot just send your whole workforce back to work, but now have to make a selection in terms of criticality, importance, and it's important to share that information with the workforce so that they understand what are the arrangements with regards to returning to work, so that you don't have animosity between why a certain group is going back to work and the rest is not, and then potentially see protests in and around your facility because the information was not shared. Of course, accompanied with that is a whole lot of anxiety with regards to employment. And as you know, the numbers in Africa is quite concerning, was always concerning before COVID-19. So we also might see potential protests with regards to job losses and pressures that companies are experiencing, and where they have to make some financial cuts just to survive and to be able to operate. And then most importantly, we will have seen and potentially will see going forward xenophobic related violence. And this is especially against nationalities that are associated with bringing the virus to Africa or are being blamed for the cause of the virus spreading in Africa. And it's very important that we know what those nationalities are, identify them as part of our workforce, and make special arrangements with regards to their mobility, protection, and support when it comes to exposure in the countries. Thank you, Michael.
Super. Anneline, thanks very much indeed. Just turning to Europe now, clearly most European countries are now in the waning phase of the pandemic event. Dr. Kate, just turning to you, can you give us some indication of the challenges that the European clients are facing now, especially in regard to the de-escalation measures that they might be deploying?
Yes, thanks, Mike. Hi, everyone. So we've seen a number of countries across Europe start to ease lockdown measures. And for every country, it's happening in a slightly different way, and they're basing it on their own modelling, you know, their own cultural backgrounds, what the needs of their populations are, and what they believe is safe to do. So it's all based on what we know of the virus and how we get infected, which is obviously the same worldwide, but each country is doing things slightly differently. And this makes it quite challenging for companies that are present in many different countries in Europe and throughout the world to return to operations in a consistent manner, because many of the countries expect you to adhere to different rules. So, for example, the quarantine rules for different countries ranges from no quarantine to a strict 14-day quarantine. So obviously, this will have quite a lot of impact on some travellers. And there's also then having to factor in around travelling, what happens when you travel from country A to B and you've checked all those requirements, but then you need to go to country C and there's another set of requirements. So with all the different restrictions in place, and in the next few weeks, especially in Europe, we're going to see more lifting of restrictions and more lifting of the travel restrictions in particular. It gets quite complicated and it's quite fast moving for countries to keep up with. We maintain a lot of this information on our pandemic site, and we keep all details of restrictions, which can help. But you know, some restrictions have been eased today in France. So France have opened the borders to some European travellers today. Italy opened some borders last week, and then in the UK at the moment, you know, we have implemented a 14-day quarantine rule for people coming into the country. So there's lots of factors that companies are having to take into consideration when planning on allowing employees to travel and in getting employees back to work. Thanks, Mike.
Lovely, thank you, Kate. Appreciate that. Let's move on to Dr. Olivier now. Olivier, a slightly different view in terms of you've been working with some specific large clients across the Asia environment. What are the unique challenges some of them are seeing, and especially related to the different verticals that they're working within?
Very interesting development we observe as a trend in some of the industry we are working with, namely the aviation business or commercial aviation, the commercial maritimes, the educational industries, like for universities, and the energy sector, the oil and gas and mining. And there is some commonality when all these vertical industries really struggling with the 14 days quarantine and really trying to either redevelop or improve or kickstart their various activities. And in aviation business or commercial aviation, for instance, we see a real trend trying to reintegrate testing into their various strategies, starting with the crew, but not yet for the passengers. And we see, for instance, recent publication research at the moment of new COVID-19 PCR testing using saliva and not necessarily, the swab into the nose or the back of the throat. It's not commercialized yet, but it's very interesting for the industry. We have been disappointed in the past by new innovative technology that did not work out as we were expecting for the PCR, as we call them, point of care testing. But it seems that this new innovative technology may create some further development and framework allowing the aviation industry, especially for the passenger travelers, to speed up in terms of recovery. On the commercial maritime, we see, the tankers, the oil and gas, but also the bulk cargoes, they continue to be the backbone of the supply chain for the last few months, and they continue to do so. The seafarers and the crews were stuck on their ships for months because there was no rotation, no health immigration port authorities will accept them to disembark and change crew. And now we see countries like Singapore, other hubs like recently Hong Kong. Last week, the government, after discussing with the Hong Kong Ship Owner Association, opened the door and allowing a corridor, a safe passage, for instance, for all the seafarers and crew transiting via Hong Kong without being subject to all the testing and isolation, etc., and moving straight to their ships, for instance. In the education system, very different environment, same problem, same agenda, trying to see if there is any way using integrated testing and negotiation with the various health authorities to open a health corridor, for instance. Remind you that universities, for some of the prestigious ones, are really struggling to bring their foreign students back. These foreign students may represent up to 50%, even more, in terms of financial revenue for some prestigious universities. And so they are not hesitating even to mobilize charter flights to bring students back to the universities in the coming months. And finally, the energy sector, the oil and gas, as well as mining. They were the first one to really look at the integration of COVID testing into the multi-layer prevention to avoid outbreak of COVID on board their rigs offshore or their seismic vessels or a remote site for mining. And they're probably the most advanced industry today, implementing research on how to wisely integrate or use these PCR testing and antibody serology tests for the management of the COVID at the workplace. So we know that all of this is not the favor of WHO, who tends to recommend only for research the use of this testing. As actually, that's what the industry is doing now, and the oil and gas and mining is probably the most advanced one. So those are the quite unique trend that we start seeing in some of the industry we're working with. Mike, over to you.
Thanks, Dr. Olivier. That's a fascinating view. Let's turn now and look at some of the recommendations that we have across our organization and across these different sectors. Perhaps, firstly, I can come to you, Anneline, and just let's have a look at where we are from a security point of view in terms of recommendations around the safe return to operations. How are companies being recommended to take this approach?
Thank you, Michael. The return to work, safely return to work of operations is, of course, guided and directed by selective protocols and measures within countries. And as we've seen throughout Africa, especially Nigeria, where you have different lockdown measures in each state, which complicates operations. Foreign company, for example, who operates in more than one state in Nigeria, but have to make sure that the information that they manage is of such a nature that it applies to the areas of their operations. So very importantly, companies need to ensure that the information that they have or that they receive are first credible. It is information that comes from a valid resource, and it is information that is that is been verified to be able to ensure that they comply to the lockdown requirements that is being put in place in some of these countries as a whole, but as I've mentioned in Nigeria, different states. You also see that countries have different risks and threats across Africa that they are exposed to. For example, in some cases, countries have chosen to continue with elections that may be upcoming in their country. And it's very important to see how they will then implement measures to ensure that they not just address the challenges or the requirements that comes with COVID-19, but now have this added pressures, for example, elections, for example, political unrest, for example, any socioeconomic conditions that might exist in that country, and that they now additionally have to cater for or additionally have to make provisions for to ensure that they comply and also incorporate that into their crisis management plans. We've also seen that with regards to natural disasters, unfortunately, has not been stopped by COVID-19, and these also then implement or affect selective countries as they operate throughout Africa. So I understand the question that you're saying in terms of workforce resilience and what countries have to make sure that they have in place for best returning to work. But it's very important to understand that within the context of Africa, other than COVID-19 and what the government put in place, they also have these additional security challenges that they have to cater for to make sure that when their staff return to work, they will be able to accommodate and support operations within these areas that they operate in. We also see some of the countries still having those lockdown protocols in place, and with the lockdown, it's very important to educate and to support workforce with measures how to engage with the security forces within that country. We've seen quite a concerning number of deaths related to police brutality and the force of the security forces within countries. So as part of the refresher training going back to work, you have now to add these additional features, how to manage a roadblock, how to engage with the police for those staff that will be returning to work to ensure that they can then effectively make their way back to work and then back home. Thank you, Michael.
Thanks, Anneline. Let's move on to the medical situation, and Dr. Kate, perhaps you can give us a bit of guidance on what you're advising organizations, how they should ensure that their workforce stays safe and healthy once they have returned to work.
I think that's the important thing, isn't it? Providing a safe and healthy workplace for the employee. And for some employees, you know, it may not be absolutely necessary for them to get back to the workplace. You know, can they still work remotely, work at home? And, you know, this could continue for a good number of months. But in terms of getting people back to work, I think the first thing to look at is kind of pre-return. So, you know, how are you communicating with your employees? What policies have you put in place? You know, as well as doing a risk assessment for the organisation, doing risk assessments for individual roles. You know, those people who may have interaction with public, how should they interact? What social distance measures should be in place? Wearing of masks, regular hand washing, hand sanitizer, and all that needs to be communicated early and clearly. And then how are the employees going to get to work? Are they going to travel by public transport or private means? The wearing of masks, is that just for public transport? Are they adhering to the local authority guidelines, and how are they maintaining social distancing on their journeys to work. And then once they get there, what measures? So are you going to introduce a point of entry screening? And this could be temperature checks, which many companies have implemented, questionnaires. So there's a lot of things that people can do to screen people as they come into buildings. And then within the office, you know, how are you going to manage workstations? Are they going to be zoned? Are you going to keep people separate? Are they going to be work bubbles? And then how are you going to manage your communal spaces? So kitchens, toilet facilities, we need to look at all of those. And then once you've thought about all that, you know, what will you do if someone gets sick while they're at work? What's the protocol? What measures have you got in place? One, to protect the person who's sick and get them treatment in a timely manner, but also to protect the colleagues around them and prevent them from getting sick, so that everyone has a clear knowledge on what to do and how they will be impacted. And I think throughout this pandemic, and we've talked about it a lot, is, you know, what emotional support are you going to provide for your employees? And I think, you know, one of the key things is good communication at all times about not only the services that are available, but, you know, people being able to ask questions and voice their concerns so that these can be addressed in a timely manner, and hopefully keep, you know, our workforce feeling confident in the systems in place, so that when they get back to work, it's a pleasurable experience and things run smoothly. Thanks, Mike.
Great, thank you, Dr. Kate. And presumably emotional support is a key element of that provision. Let's go back to the industry verticals and Dr. Olivier again. You ran through commercial maritime, aviation, oil and gas industries. What are we advising around an industry area in terms of that guidance relative to the return to operations?
Yeah, I think, Mike, there is three common trends. I would quickly summarize. The first one is all the companies we've seen, they understand that COVID-19 is not over. As you've seen, we're witnessing spikes or a new outbreak maybe in Beijing, and we don't know what the future holds, whether it will be a new wave maybe this winter or not at all. It may be instead a slow burner and the virus disappearing slowly. So this is the understanding of the various verticals of the industry. So the second conclusion, and the second point as a conclusion that we see is the successful companies all have drawn a decisive plan of action, and they remain flexible. That's the commonality we see. And those who are not doing that, they don't fare very well. And the third and most important point is whenever they can, they make sure that all their activities in prevention make sense medically, and they get a reliable health advisor or a reliable source of health information so that they are better in a better position to make business decisions to resist or kickstart their business again. So what we see that within each industry, no company is the same. So what the neighbor is doing is not necessarily what that company should do. And it seems that to be a successful recipe for what we can see.
Lovely. Thank you, Dr. Olivier. Firstly, thanks to the panel of experts who've joined me today from all over the world. It clearly is a message, an area that is absolutely at the front end of discussion in all organizations. And if you need any further assistance regarding guidance for your company, then do reach out to your local international SOS security or medical facilities. We're absolutely open to help you find the right solutions for your organization. As Dr. Kate mentioned earlier on, we've got a very detailed website and portal available for you to go and resource information. And again, do just reach out to us to help. And very much look forward to you joining us again. So thanks very much for your time today, and have a very good week ahead. Bye-bye.